Very good evening, friends, and a very happy new year to all of you. I expect that all of you will be a very good homeopaths in future. You will going to work hard for the sake of homeopathy and develop yourself as a good homeopath and will be very useful in making or in the treatment of suffering mankind. So today we're going to start with our session of Materia Medica. We're going to learn very short remedy, but a wonderful remedy which I have used many times in my practice, specifically whenever I had a chance to utilize it in a dengue fever, and that is the Carica Papaya. It is an Indian drug. It has been proved by Dr. D.N. Ray, and he has utilized this remedy many times. I have read the book by Dr. D.P. Rastogi on Indian remedies. It is indigenous plants, and that has explained me or gave confidence to utilize homeopathic remedy, Indian homeopathic remedies many times. And because of which I become confident in prescribing the Carica papaya. Basically, I have used it in specifically dengue fever. A patient was admitted in KEM, Pune, and he was admitted for 5 days. His fever was not getting control. He was having very severe body ache associated with hepatosplenomegaly, and his platelet count was decreasing day by day. And on fifth day, it was nearly about 15,000. And the his attendant who was very close to me, he called me, sir, there is a problem with our patient. He is deteriorating. He doesn't have a strength. He is having tremendous weakness. And doctor said that this is dengue and there is a swelling to his liver, spleen, and his eyes are absolutely looking yellow, and they are saying now there is a tension because his platelet count has reduced to 15,000, and today morning he has passed little bit reddish urine. So they called me and they explained the severity of the condition. So what can we do in homeopathy? And already everything is going on. His fever is not getting controlled and he is having much more indigestion. He doesn't have a interest in eating anything and he is disturbed so much. So he was there in Pune. I have suggested him you start with the Carica Papaya mother tincture immediately and follow along with the Naxvomica 30. Nux I have given in order that he already had lot of allopathic medications with it, because of which a tremendous nausea or acid peptic trouble which develops, Nux state develops because of it. And Carica is a wonderful remedy where the hepatosplenomegaly associated with dengue, associated with thrombocytopenia, associated with jaundice, if it is there, then Carica is the wonderful remedy to be considered. So I have given him this prescription. I asked him to call me daily and reply me. The next day, there was a phone call after 24 hours that patient has fever today. He had never had a fever. He's much better. He has taken some food today. He wanted to eat. Doctor said that instead of today, will do the platelet count tomorrow. And again, after 48 hours, they called me and they said that today we have done the CBC and platelet count has read to 35,000. And patient has improved a lot. He wants to eat now that, and then yellowness in the eyes has been much reduced, and he is passing good amount of urine as well as he has passed the stools after starting your medicine, and he's happy. And within span of 3 4 days, next 3 4 days, his count returned to normal 1,61,000, and he was completely out of danger within span of 4 days. So this is Carica papaya mother tincture. I used to use it either in mother tincture or either in low potency, 6 potency. I used to use the Carica papaya. Generally, 6 I used to prefer many times than the mother tincture. It's a wonderful remedy for such types of patients. And second important, whenever abortion is there and missed abortion is there, I have used the Carica Papaya, where it throws away the contents like a sabaina. So this is very important remedy. We'll read it from the Boericke Materia Medica, very short. In Indian drugs it has been mentioned. So in my Boericke Materia Medica, it is on page number 1057, Carica Papaya Penpe. There are many names in different languages. In Marathi we called it papaya, Hindi also papayam. First floor is Dr. D.N. Ray. The family is Passiflori. Clinicals: abortion, dyspepsia, conjunctivitis, enlarged liver, enlarged spleen, uterine disorders. Gastrointestinal symptoms: enlarged liver and spleen with fever. In dyspepsia, weak digestion. Undigested stool in small quantities for many times a day. White coated tongue. And there is one feature which is intolerance of milk. It is close to Ethia synapium like this. It promotes digestion, especially of those whose stomach can't tolerate the meat and milk. So this is very wonderful remedy for milk intolerance, meat intolerance, for indigestion. It works very, very clearly. Eyes, there is yellowish discoloration of the conjunctiva. Female sexual system, it aids the menstrual discharge, helps the uterine contraction, and induces abortion when locally applied to the mouth of the uterus. This is the reason why the females who are pregnant, it has been said that they should not use the papaya, because this generally induces the abortion, and that's why they should not take the papaya, because it has the capacity to contract the uterus, and that's why it is, if there is a missed abortion or if there is a incomplete abortion, this remedy works beautifully. If you give it in mother tincture, it contracts the uterus and throws the products over there. Potency of choice: mother tincture 1x, 3x saturation. Generally, I used to use mother tincture or 6C potency or 3C potency. So this is a very useful remedy, Carica Papaya, in clinical practice basically. Those who used to handle the acute, subacute cases where the jaundice, hepatosplenomegaly associated with dengue fever, one should not forget Carica Papaya. So that's all for today's session. A short remedy, but included in our fourth year syllabus. And that's why very useful from your point of view, student point of view, as well as from practice point of view, we have finished. So that's all for today. Thank you and good night. Tomorrow we'll meet again with one more remedy.
Thank you very much, sir.
Thank you, sir. Good night.
Good night.